So next is nasogastric tube, garbage or feeding. So first, preparation, check and verify the doctor's orders. Next is warm feeding formula or allow it to thaw at room temperature. Next is verify patient identity. Next is explain the procedure to the patient and relevant others. Next, assemble and check equipment for functionality. So next is wash hands and don gloves. So next is feeding procedure. So first, place or assist the client in semi or high Fowler's position. Place a towel or absorbent pad on the patient's chest. Next, assess tube patency. Inject air using a septosyringe or in the tube while auscultating for gastric sounds using stethoscope. Place on the epigastric area just below the xiphoid process. So next is check gastric residual. Return aspirate contents unless the volume exceeds 100 ml. So next is flush the tube with at least 30 ml of water unless otherwise ordered by the attending physician. So initiate feeding. Pinch the proximal end of the feeding tube. Next, connect the aseptic syringe or 10 ml syringe to the tube. Next is fill the syringe with a measured amount of enteral nutrition formula or austerized food. So next is release the tube and elevate the syringe to no more than 18 inches above the insertion site. Next is allow the austerized food or enteral nutrition formula to empty gradually by gravity. Next is refill the syringe until the prescribed amount has been given to the client. So next, in the availability of an enteral feeding container. First, close the regulator. Second, place the desired amount of enteral feeding. So, enteral feeding formula into the container. Next is hang the container to the desired level. Next is slowly prime the tube of the container like priming an IV tubing. So, next, connect the container tubing to the end of the nasogastric tube. Next, regulate the flow of the formula by gradually releasing the regulator. Next is if the enteral feeding formula is prepared commercially in a sealed bag or container with a tubing. Next is connect the bag or container with this enclosed enteral tubing. Prime the enteral tubing as you prime an IV tubing. Connect the NGT tube to the end of the enteral tubing. Next is regulate the flow of the formula by gradually releasing the regulator. So next is flush the tubing with 30 ml of water. Next is cap the distal end of the tube. Next is maintain the position for at least 1 hour. Then assist the client to a position of comfort. Next is clean NGT feeding materials and discard appropriately all used items. Next, remove gloves and perform hand hygienes. And last is remove the procedure according to hospital guidelines.